Hi everybody, my name is Kyle Garaspe, and today we'll be discussing periodontitis, including its etiology, prognosis, treatment, and more. With this video aiming to educate public health workers, we will discuss periodontitis' pathways, types, symptoms, causes, treatments, prognosis, and relevance to public health. Now, you may be asking yourself, what is periodontitis? Well, we have the answer for you. Periodontitis is a chronic inflammatory disease of the gums that causes the destruction of the tooth's supporting tissues and eventually destruction of the tooth itself. Periodontitis initially begins at an earlier stage of gum disease known as gingivitis. Gingivitis is caused by an accumulation of bacterial microorganisms along the gum line of the teeth. These bacteria come together to form a substance called plaque. Plaque, which is a combination of bacteria and saliva that is produced following the consumption of food, is constantly formed the moment that you finish brushing your teeth. If plaque is allowed to continually build up along the teeth, eventually the plaque will penetrate the gum line, indicating the progression from gingivitis to periodontitis. It should be noted that there are multiple types of periodontitis, including aggressive and chronic periodontitis, which differ in the rate at which the disease occurs, periodontitis as a manifestation of systemic disease, which is associated with physiogenic diseases like diabetes, and necrotizing periodontal disease, characterized by necrosis of areas surrounding the tooth. Although there are numerous types of periodontitis, similar symptoms, treatments, and risk factors are shared by all of them. In the majority of cases, symptoms will include swollen, red, or tender gums, a constant bad taste in the mouth, and bad breath that can't be alleviated by brushing or flossing, loose teeth separating from one another with pus forming in between the gaps, as well as a misalignment of the teeth. However, among all symptoms, the most important characteristic of periodontitis is the formation of a large pocket located between the teeth and the gums. Causes leading to periodontitis mainly stem from negative lifestyle habits and can include inadequate or an absence of consistent toothbrushing, habits that promote plaque buildup such as smoking, as well as unhealthy dietary habits, especially ones that include lots of sugary foods. Treatment does not usually differ by the type of periodontitis, but will differ based on the stage of the disease exhibited by the patient. Regardless, treatment will be performed by a dentist with the goal of removing bacteria in the mouth to either heal the gums and promote reattachment of ligaments, or at minimum, retain as many teeth as possible for as long as possible. Prognosis depends on the severity of bone loss, which largely depends on the amount of time that periodontitis is left untreated. Pockets formed between teeth and gums will continue to get deeper and deeper, allowing for progressively more destruction of tissue surrounding the tooth. Furthermore, deeper pockets are more susceptible to producing abscesses, which all come together to accelerate bone destruction. As a result, if teeth have become too loose due to periodontitis, they will have to be removed. Fortunately, if bone loss is not too severe, periodontitis can be treated to avoid loss of teeth. Treatment through removal of bacteria and plaque will be uncomfortable. However, time will allow any bleeding and tenderness to heal. Furthermore, gums will regain normal shape and function, and pockets will be reduced while ligaments will reattach throughout the mouth. In order to prevent the development of periodontitis, taking action at all stages of the disease is essential. The most effective ways to combat its development is by 1. Practicing proper dental hygiene, which includes consistent toothbrushing and flossing, and 2. Ensuring that you take regular visits to your dentist for cleanings and checkups. Now this brings us to our last topic of why you should care as a public health worker and the significance of periodontitis through a public health perspective. By understanding that visiting the dentist for cleanings and checkups is one of the most important measures to preventing periodontitis and gum disease in general, it is essential that we increase access to this resource for people of all demographics, backgrounds, and geographical locations. However, because many insurance plans within Ontario, such as OHIP, do not cover dental services, which can often be costly, we can see how social determinants of health, such as groups dealing with low income, may be hesitant to visit the dentist. This is clearly an issue, as a review conducted by Papapanu and Susan found that when access to dental care is readily available, severe cases of periodontitis are far less likely to be diagnosed as hopeless with the need for tooth removal. Therefore, as public health workers, it is our responsibility to increase the number of services and programs that increase and provide access to dental care for everyone. Thank you for listening, and remember to always brush your teeth.